A good healthcare hero
is passionate about his work,
has strong work ethic, and friendly.
There are many possible healthcare heroes in this community.
But there is one doctor who stands out the most.
Dr. Sidney Johnson. How do you differentiate Dr. Johnson from other doctors?
Not just because he's my doctor, but like I trust him a lot. Like he's somebody that's very humble, that he will, he's a good man. He explains things very thoroughly, and he even gives his cell phone number if he has to, like if a complex patient and then they have a lot of questions. He's always there.
What is the key to being a good doctor?
Being open-minded, because like basically, especially in Hawaii, because you have so many nationalities, so much, you know, culture, so much religious beliefs, and like if one doctor only believes in one thing, he's not going to be able to get on the same page as a patient. And
I think mostly just talking to people, just having good friendly relationships with people. I think that you got to be able to make time for people. Making sure you do the important things that the science of medicine requires, that's important. But I think people consider you to be a good doctor if you just spend the time with them and answer their questions.
How do you see medicine changing in the future?
I think it's just going to continue to get better. I think that hopefully costs will go down, but I think mostly technology will get better. I think the surgeries will get smaller. I think the number of surgeries we have to do are going to be fewer. And I think the medicines will get better to treat, diseases and problems.
What do you like most about being a surgeon?
Well, I really like operating. I think it's fun because I get to use my hands and work with my hands. I get to physically solve a problem, see the disease go out. I think you actually get to see the results almost immediately.
During surgery, how many people are usually in the operating room?
There are usually at least 2 doctors, but often 3 or 4. So there's at least the anesthesiologist and the surgeon, so those are at least 2 doctors. There's often a resident or 2 that are doctors they're fully doctors, but they're also training to be subspecialists. Registered nurse, there can be sometimes 2 registered nurses, bare minimum 4 people, but there's often 9 people in the operating room, just doing different jobs and making sure the patient was safe.
How do you know that you are doing a good job?
Surgeons participate in some type of measurement process, what we call outcomes databases. And essentially, it's like studying yourself to see if you're doing a good job. And so, if you fix hernias, you want to make sure that they don't come back. If the hernias come back too often, then you need to figure out how to do hernias better. And so, and we look at things like infection, we look at things like problems after surgery, bleeding, blood transfusions, that sort of things. And so we get measured on all these different kind of outcome measurements. Surgeons are learning to measure their outcomes to figure out and to make sure that they're doing a good job, knowing where we can improve.